The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mike Willett with the National Native Network at the Intertribal Council of Michigan. Welcome to the NNN webinar series on cancer risk reduction in Indian Country. This webinar is titled Policy, Systems, and Environmental Changes for E-Cigarettes and Tribal Communities. This technical assistance webinar is being hosted by the National Native Network with Indian Health Service, Health Promotion and Disease Prevention, and a partnership with the American Indian Cancer Foundation in coordination with today's Great American Smokeout. We offer technical assistance and resources for commercial tobacco and cancer prevention and control throughout Indian Country. And today's webinar is being presented by Terra Houska from the Oglala, Lakota. She's a tobacco control consultant. There will be no CEs being offered for today's presentation. No commercial interest support was used to fund this activity. If you have any questions, please type your questions into the question box on the lower right-hand corner of your screen. Questions will be answered during the last few minutes of the webinar. And now at this time, I will pass it off over to Terra Houska.
Good afternoon, everybody. Like Mike said, I'm Terra Houska with the, I'm a member of the Oglala Sioux tribe. And if all of you have seen, the Oglala Sioux tribe is, I think, the first tribal community to ban e-cigarettes on the entire reservation, and that includes sales, possession, and use. So that's something that I know our people are really proud of. So overview, the policy and system changes for the tribe, how that kind of affected them, the environmental changes, educate the community on e-cigarettes, what is vaping. I've done a lot of presentations and a lot of people don't know what vaping is or what's in it. The CDC and FDA standing on electronic smoking devices, and why are vapes causing people to become ill and even killing them. So on September 29th of this year, the OST Council voted to ban e-cigarettes on the Pine Ridge Indian Reservation. From what I was told, it wasn't an out of the park win. It was really close. A lot of people wanted the votes to go to the people rather than the tribal council, but the council voted on it and it passed. They tried to rescind it, and the council voted again, and it passed, I think, like 5-1 or something similar to that. The ban, like I said earlier, it included the possession, sales, and use. And my question is, what does this do for the people who live on the Pine Ridge Indian Reservation? Well, a lot of people don't have transportation, so they're buying locally. It cuts off that tie, so they would have to go to a bigger town on the outskirts or city on the outskirts of the reservation to do that. So it stops easy access to those things. And I'm not sure exactly how many stores on the reservation carry electronic smoking devices, but there's not a whole lot of stores on the reservation. But usually each community has like a small store. And I think it also gets people talking, you know, oh, they're banning those. Well, why are they banning them? So people start to educate themselves on why these things are dangerous. how do you change the environment so people understand why it's important to implement these policy and system changes? Education. Education is the most I've seen with the most that I've seen for I'm sorry. Education is the best way, in my opinion, to get these policy and system changes, like to implement them and to get people to understand why they're being made for, you know, our tribal communities. And a lot of those, it could be like presentations, publications, so like booklets, brochures, and that type of thing. Events. So like I've seen tribes do like sponsor free throw contests. Like this is sponsored by, you know, the tobacco prevention program, and different things like that. Newsletters, especially with the new social media and stuff, a lot of word gets out that way. And then health fairs, you know, a lot of people go to these health fairs and get the information. And I might back it up. I think that, oh, we'll go back to that later. So what is vaping? So for those of you that don't know what vaping is, these are a picture of a lot of the different devices. So there's like tanks and mods. There's rechargeable ones, which do contain lithium batteries. So a lot of people that do smoke them, it can blow up in their faces. Trying to see what else. And a lot of them do contain nicotine. I think that some of them you can get without nicotine. I know the jewel sticks, those ones all contain nicotine. And I've seen some of the mods and tanks do more of the flavor ones. Okay, so what's in e-cigarettes? It's a mixture used in vapor products, such as e-cigarettes, and it consists of propylene, glycol, glycerin, water, nicotine, and flavorings. And the ingredients vary. The liquid typically contains 95% propylene, glycol, and glycerin. And those are in a lot of different foods and used as a preservative for different types of foods, medications, and stuff. And it's approved by the FDA for consumption, but a lot of it's not approved by the FDA for inhalation. Okay, so CDC recommends local, state, and tribal health departments to inform their communities that they should not use THC containing e-cigarettes or vaping products. There's a lot of people on the, I don't know if it's considered the black market, that are making their own vape pods, and they're putting THC in it and different things, and that's where a lot of people are getting sick from. This vitamin E acetate should not be added to any e-cigarette or vaping product. So they're seeing that in a lot of the cases where people are getting sick. Anything that is like, if you choose to vape, use the store-bought products. I wouldn't try to make your own to save some money. The FDA, they are looking to put more regulations on the e-cigarettes. They've worked at maximal speed to regulate it, but the policies and procedures are still evolving. It's all happening very fast to where I think FDA is having a difficult time keeping up. So there are about 460 brands of e-cigarettes, which is a lot. And just that amount shows that e-cigarettes should be regulated. There was a study done, and the study examined how the online market for e-cigarettes changed over time. So how they did their advertising was everything, and that's how they blew up, and that's how they ended up appealing to the youth because of how cool they were and the different flavors that they had. And then a lot of them are say they're for cessation, and a lot of people, I think, have been successful to stop smoking using those and slowly using less and less nicotine. But some people have been addicted. So some people never smoked before they start using vape products, and then they're hooked on nicotine. Why are e-cigarettes causing people to become ill? So that vitamin E acetate, that's the stuff that people are adding to it. But that was only from 29 of the patients that were registered with CDC. And there's around 380 reported cases in the US. So even though that vitamin E acetate is linked to people getting the pulmonary illness, only 29 of them, the patients that are reported, had that in their vapes. So these are some of my resources that I like to use and go get the up-to-date information about e-cigarettes, and that's like CDC, FDA, here National Native Network, they keep it sacred, No Smoke, the Americans for Non-Smoker Rights, GPTCHB, which is the Great Plains Tribal Chairman's Health Board. That's a great resource here locally in South Dakota or in the Great Plains area, and then the American Indian Cancer Foundation. So all of those have really great resources for e-cigarettes, policy developing, and just about anything that you can think of should be in there. And then what's next? So e-cigarettes are not federally taxed because they are not officially a tobacco product. They don't go to the tobacco fields for e-cigarettes. They contain a nicotine-laced liquid. So it's just a liquid. They don't get it from the tobacco plant at all. So they're not taxed federally. My suggestion to tribes would be to, if you want to allow those to be on the reservation, is to add a tax to them. You know, that way that, you know, you're getting money to go for education and outreach to tell people not to do it. Ban or regulate them. We don't want to see them costing IHS millions of dollars in the future like commercial tobacco. The 4 of the top 10 causes of death among American Indian and Alaska Natives are all related to smoking, and it's pulmonary illnesses, diabetes, heart and stroke, and I can't think of the other one off the top of my head, but you know, it's a huge contributor to a lot of our health problems. Cancer. It's a contributing factor to our people's health in all tribal communities across the US. So I like to educate. Educate everybody, educate all ages. I've seen in some of my presentations older teachers or nurses, they don't even know what some of these e-cigarettes look like. And I was like, well, they could be charging in your school computer. You know, it looks just like a flash drive, some of them, you know, and people just don't really understand. Some of them don't let out scents. And some of them you can't really see the smoke as much. I know kids will turn their hoodies around backwards and blow the smoke into the hood of their hoodies too. So, you know, kids have figured out a way to do them in class. And if they're putting CBD oil in these themselves, what else are they going to put in there to experiment with? You know, I think they just need to go away. This is my contact information. I also put the president of our tribe, Julian Bear Runner, on here as a contact person. And then, did we have Chase on the line, Mike? Okay. Chase, did you want to speak a little bit about the policy and what you've seen locally in Pine Ridge?
It looks like Chase is still on mute on his end.
Okay.
Gotcha. Okay, sorry. There we go.
It's okay.
Is that right?
Yep, I can hear you.
Who was that? Was that Terra just now speaking?
Yeah.
Oh, okay. All right. Awesome. I can't tell you the date of when the Oglala Sioux tribe adopted some e-cigarette legislation, some regulations really, and that's with tribal governments. Really, it's open waters really of what we can do, what we can regulate, and so forth. We're seeing that also with testing the hemp production and cultivation, but with vaping, e-cigs, I just call it, maybe there's some technical or legal distinction between those, but I just call them all the same thing: e-cigs, vaping, and so forth. We appear to have recognized the health dangers of this phenomenon, and have completely outlawed it theoretically and legally as well. But at some of the stores, they're still selling the various components of the paraphernalia necessary. Those little I don't know what those are, battery pack charger thingies, and how they inject the substance. They still sell those on various places on the reservation, as well as some other questionable things. So maybe this the enforcement isn't quite there yet, but we've also haven't had any, as far as I know, any serious incidents related to vaping. I don't know what went wrong, but I know people died, and I know it was highly publicized. But when it comes to nicotine, I mean, it in my opinion, it should be regulated just like we should be regulating sugar. We don't regulate sugar. We also regulate alcohol, but with nicotine, like Terra was saying, either if you're going, you either got to tax it out of existence, or it just ends up another way to get kids addicted to a substance. And as much as we can promote clarity, or abstaining from those substances, especially while they're younger than 18 or 21 or whatever, I mean, that's not practical on the reservation, because or even in the city centers, because it's just kids are much more advanced in terms of like graduating to things. Anyhow, that's kind of where we're at. I don't think we have anything set up in terms of reporting, enforcement. That'd be a question for the law enforcement or the chief of police or something like that. But yeah, thank you guys. Thank you for doing this.
Chase, I have a question for you.
Mhm.
Have you seen, I know there's been backlash in the tribal communities about banning this. Do you guys have anybody that is answering those questions? Like, why is this beneficial to the people who live on Pine Ridge?
Right. No, nobody's other than myself feeling those questions from for the media. We just don't have the money to have, an apparatus set up like that, like an education arm of it. But we should. The only thing I can say that we can attach that to is an initiative moving right now to educate people about the benefits of medical cannabis. So there's an opportunity, but on a practical level, Pine Ridge is big, and unless you can get people out voting and paying attention, we'd be able to do something very clever though in terms of education if we do have the tribe authorize a referendum vote on medical cannabis.
Mm-hmm. Okay.
So we do have some time for some questions. If folks have any questions, feel free to type them into the question box in the lower right-hand corner of your screen. If you go ahead and type those in, then I can go ahead and ask aloud for everybody to hear. And I think that Terra and Chase will be happy to answer some questions. Let me see here. So this first question here says, implementing a high tax on the products would help make usage less accessible. So I think that was just kind of a general statement. And then this next person says, this question is for, well, President Running Bear, but hopefully Chase can maybe touch base on it. Cigarettes are just as deadly, especially among natives, yet tribes continue to allow smoking in public and workplaces, including hotels, restaurants, and casinos. Any plans to pass comprehensive smoke-free policy for your tribe?
Can you hear me?
Yep, I can hear you.
Yeah. Currently, there are none, but what is at play and what is in the works is the tribe passing its own tobacco cultivation regulation so that we could outlaw outside tobacco. And then, if a lot of people smoke tobacco, it's a bad thing. But that tobacco should be we should be able at least to ensure that it's additive free and as pure as it can be. Maybe nicotine inherently contains carcinogens. I don't know that. I don't know, but I know that big tobacco is not to be trusted. So I can tell you that as far as tobacco, that we do have a relationship with it that we need to respect.
Can I add one thing on there?
Yep, absolutely. I was just going to ask if you had anything to add, Tara.
Yeah. In the press release that President Bear Runner released, he did say he wanted to do more with tobacco and regulating commercial tobacco on the reservation. That this was just one of those steps to getting there. I don't remember the exact wording, but
right.
Okay, this person asks, what are some challenges in getting the policy adopted?
I would say we don't have we don't have the money to start. We've got to rely on the police department being able to kind of increase their knowledge and capacity. So that is a disadvantage, but it's currently also how we enforce alcohol and everything like that. Like I said, those things in the stores. I mean, obviously we haven't cracked down yet, probably because we haven't had any problems. which is not, it's not necessarily a good thing, but it's just kind of sometimes how things happen. It's not like we adopted dog legislation, too late after a young girl lost her life. Then we start worrying about dogs on the reservation. But with this, you know, I don't foresee there, unless we get a big grant or something that where we can deal with enforcement and education. We're just going to continue to rely on the police and stand against the negative kind of intent behind of big tobacco. I'm of the same opinion. The tribe hasn't said anything. Nor Julian's intent, the president's intent to regulate big tobacco, could come in many forms, and part of that is also strengthening our sovereign character, being able to protect what comes onto the reservation and what's allowed here.
Terra, did you have anything to add?
Yeah, I can't say for like e-cigarette policies, but a lot of the smoke-free air policies across the reservation, it's hard to get people to buy in to it. So, the best way to get people to buy into it is to just educate them, especially start with the kids. They go home and they yell at their moms and dads and aunties and uncles to not smoke around them because they learned that in school. So I think it's education is definitely the key for tribes to pass these policies and these systems.
This person here says, what kind of education was provided to tribal council members prior to their vote? Was education provided to reservation residents prior to the vote?
No, I know that as far as no public education, and as far as what happened at the council meeting that day, I couldn't answer that. I'm not sure.
I had sent Julian a bunch of information from the FDA, the CDC, truth.org. I sent all that to Julian before the council meeting so he could look at it. He
Okay.
said he'd review it with his lawyers and stuff.
Okay. Yeah, great. I wasn't in that conversation.
This person here says, was there any pushback or discussion around loss of revenue for the tribe from sale of vape products or loss of money from taxing vape products?
No, I don't think nobody really notices. And I didn't see any public education campaign on the part of Big Tobacco, because usually sometimes some kind of funky vote this way or that way against this proposition or that proposition. Usually it seems to Big Tobacco requires the local retailers to hang those things up in their places of business whenever there's a measure, whenever their profit margins at risk. I didn't see any of that.
Terra, anything to add?
What was the question again? The sales?
Was there any pushback or discussion around loss of revenue for the tribe from sale or from taxing?
Yeah, there's no taxing on e-cigarettes in Pine Ridge right now. And I don't think the tribe owns any of the entities that sell e-cigarettes. They're all privately owned.
Right.
And many of them are non-tribal members.
Okay. This person here says, hi, thanks for the information to Tara and Chase. The CDC has put out guidelines for healthcare providers in terms of assessment and how to treat patients who vape. Do you know if those guidelines have been disseminated to your healthcare providers there at Pine Ridge?
I don't know that.
Yeah, I don't know that either. I would assume that somebody had gotten it, but I'm not positive.
Do you guys get any tobacco prevention dollars, maybe from CDC or other funding sources?
I can't answer that on behalf of Oglala Sioux tribe just because I don't know. I'm a relative newcomer, but I know that there are dollars floating around South Dakota directed at indigenous people, for tobacco awareness and so forth.
Yeah, I don't know of any either off the top of my head that the tribe directly gets for tobacco.
This person here says, what other health measures related to tobacco are you working on? Are you working with the state of South Dakota on this?
We are not currently working with South Dakota on the e-cigarette, but we do have a tax collection agreement with South Dakota that it could potentially be impacted. Or anytime we do with tobacco, we agree to split the tax, which is not, it doesn't make any sense really for us to be giving South Dakota any tax money that we're collecting on our jurisdiction, but we do. It's based on some federal case law and so forth. That's just kind of racist and outmoded, really. But anyhow, we sorry, yeah, I'll just conclude there.
And Terra, anything to add?
Nope.
This person here says, how's the information regarding vaping included in school curriculum and at what grade levels?
That
Mine is good. Yeah.
that, from my understanding, is kind of based on the school. So if the school reaches out, excuse me, if the school reaches out and wants the information to the state or whoever, and I know the state tries to get the information to all the schools and send it, but what age group it starts, I know on this is me speaking off of our reservation in Pine Ridge, but on the Cheyenne River Reservation, they start them as early as preschool and Head Start. So, I'm sure that some of that is going on in Pine Ridge as well.
This person here says, well, first I'm going to say that if anybody has any questions, feel free to type them into the question box on the lower right-hand corner of your screen. We'll continue answering questions as long as if questions are typed out there. This person here says, I admire your hard work and ongoing efforts to combat these e-cigs and vapes. Sometimes our young people don't see the long-term benefit, but glad that you do. Thanks.
Awesome.
This person here says, is the tribe considering taxing e-cigarettes?
No, not at all. As far as I'm aware of, they took this step in banning them, and then it stopped at that.
This person here says, how big is your tribe? What is your tribal population? How big is your police force? And what is their area that they have to patrol to enforce the laws?
We have about 30,000 people, I'd say, living here in Pine Ridge. It's about 2.5 million acres of jurisdiction. Half of that is allotted. Non-Indians own it in fee, according to U.S. title, supremacy claim title, or whatever. There's probably 54, I believe, police officers on the police force, and the jurisdiction of the res is like the size of Connecticut. It's compared to Connecticut a lot, but it's always a struggle here. A weird term that I came up with is philanthropic industrial complex. Like the conditions are such that people are struggling, and everybody we can always raise funds and justify expenditures, and then the conditions are always seemingly still there, and we're all trying to figure out how to help out. But anyhow, that's kind of a snapshot. But also there's intangible things about living here that are amazing. That's why I love living here. But that's a snapshot of language.
Yeah, if anybody has any questions, feel free to type them into the question box. Did anybody have anything to add at all? Terra, Chase, anything to comment on or anything?
I think for me as a tribal member, my relatives live in Wombly, South Dakota. So to me as a tribal member, I think it's important to, that's why I work with President Bear Runner on trying to implement this policy and set the pace for other tribes to do that. And I know, time and money is hard, especially for tribes. People are spread so thin and cover so much area and so many people. And, that's my thing. I want to educate people as a person, go out there and talk to people. And even if it's just a handful of people, that's, so that it is important to me for our tribe to expand our policies to include commercial tobacco, not just vape products, and then, see where things go there.
I like that. Thank you for that, Terra. And I think you can see kind of where the driving forces behind what happened, and it's a good step for the Oglala Sioux tribe. I share the same sentiment, and I know President Bear Runner does that. We shouldn't be taken advantage of on any level, and so it starts with these substances.
This person here says, I lived in Pine Ridge for 2 years, and I agree with Chase. You have good community there. My question is White Clay going to be selling e-cigs and vapes just off the reservation? She hopes not.
And there's not a strong enough demand for that. They can just go to Rapid and get them,
This person here says, what advice would you guys give for anyone, tribal or non-tribal, working in tobacco prevention?
Can you restate that?
I'm sorry, what's that?
Can you restate that question?
This person here says, what advice would you give for anyone, tribal or non-tribal, working in tobacco prevention?
I think the education is the key. Going out into communities, talking to the people who you would not like to smoke, educating them, sending resources home. Why, what can happen? Everybody knows smoking is bad. They still do it, but do they really understand like what can happen from it? And you start at kids and you tell those kids, these are side effects of these, and getting people to understand. A lot of people have grasped onto the concept of secondhand smoke, but a lot of people have never even heard of third-hand smoke, which, by the way, e-cigarettes, you can still be exposed to secondhand smoke. You're still inhaling those chemicals that are coming out of those vape products. So that's still a concern with the vape products. But, just educating, I think that's the biggest thing, is just letting people know, because nicotine is very addictive. It is a drug, it's a stimulant. So it's really hard to quit. And I understand why people struggle with quitting every day. And I think a lot of tribes, especially if you're a tribe, go back to your traditional tobacco ways, how you use it, what you use it for, when you use it, and that type of thing. I really promote that with our tribal communities here too.
This person here says, what programs or plans does the tribe have in place for people that are using e-cigarettes to quit smoking?
I can kind of answer that. There's not a lot of programs that are using, I don't think anybody's using e-cigarettes to quit smoking on the reservation. There might be a few, but not very many. There's some smaller programs that, try to get people to not smoke on the reservation or get funds from the state. And then I know the Great Plains Tribal Chairman's Health Board also assists with that too, you know, sending education to the tribes and to the different communities so that people are aware of the resources out there. And I know that they just got a cessation guide for Pine Ridge, and it has a list of resources in it where you can go if you want to quit smoking within the reservation boundaries.
This other person here says Oregon just rolled out a native quit line. It's live right now. It's specially tailored for Native Americans and distinguishes between traditional tobacco and commercial tobacco. And if that person has what that quit line phone number is, we'd be happy to go ahead and share it.
Yes.
Yeah. So, and then we just want to add that this webinar will be archived at our website, keepitsacred.org. We are recording the presentation right now. And we did have a problem with our handouts. The handouts did not, well, they did get uploaded to the platform, but for some reason, folks were not able to download them. So just to let everybody know that we will be able to download them once they're up on our website here in the next hour or so. Feel free to follow us on social media at our social media platforms on the screen here. Also, don't forget to visit the American Indian Cancer Foundation as well. If anybody has any additional questions, feel free to type them into the question box here. Did you have anything else that you wanted to add, Chase or Terra?
I'm good, thank you.
You know, my contact information's on the slides. If anybody has questions or anything, you can feel free to email me. You know, I would love to help anybody with their tobacco programs.
Fantastic. Well, I think that's about it for now. I don't see any other questions popping up. So, oh, actually, in fact, I do have the phone number here. It is the phone number for the American Indian Commercial Tobacco Program, which is 1-855-372-0037. Again, that's 1-855-372-0037. And that's the phone number for the American Indian Commercial Tobacco Program. They serve several states across the country. Michigan, I know, is also served with them. So, yeah, if anybody's looking to begin their journey to quit smoking, call 1-855-372-0037. And there are Native American quit coaches that are willing to help you with culturally tailored quitting practices. So with that, we'll go ahead and wrap it up. And thank you, everybody, for attending. Thank you to Chase and Terra for presenting. And we'll see you again after a while.
Thank you, guys.
Thank you.
Happy Great American Smokeout Day.
Happy Great American Smokeout.